an act to require a provincial framework and action plan concerning vector-borne and zoonotic diseases. Pursuant to Standing Order 98, the member has 12 minutes for his presentation. The member for Haldimand Norfolk.
Well, thank you, Speaker. And as I'll explain, over the past several months, I've been working on legislation designed to hopefully better enable the province of Ontario to deal with emerging infectious diseases such as West Nile or Lyme, Ebola, diseases that they seem to be catching us as a society kind of flat-footed or somewhat unprepared when they emerge. And when new or relatively unknown disease advance, public health disease treatment systems often are unprepared. Again, public health will scramble to respond, as do treatment systems, but in many cases with less than satisfactory success. We must have plans, we must have programs in place designed to not only accommodate some of the diseases I mentioned, but any new threats. There probably will be something on the horizon, perhaps Marburg virus. We don't know. Now, there presently is no legislation directing the Ministry of Health to call together any kind of comprehensive plan or program. So this proposed law would essentially set in place a decision-making tree or structure and set in place policies so that we can hit the ground running. I've often felt that our province's health care system really doesn't adequately reflect the need for prevention to the extent that it should be vis-a-vis treatment. In my view, it's a system designed to treat illness, not so much to prevent it. It's basically oriented towards physicians, towards hospitals. They're in the business of treatment by and large. I'm not a physician. I worked in the healthcare field for 20 years. I'm not a research scientist, but I did work for a provincial research agency for 20 years. Many physicians, unlike our present Minister of Health, in Ontario are not trained in tropical medicine or aren't necessarily trained in public health for that matter. And this hit home to me many years ago. I returned from a 6-month stint in South America. I was working in shipyards. I owned a boat down there, and I was up to my neck in the Paramaribo River and the Amazon, and I brought home a number of tropical diseases, skin diseases. Fortunately, my physician in Port Dover, Dr. Thompson, was from Jamaica and had training in tropical diseases, and he explained to me there wouldn't be another doctor in the area that would know what to do with what I brought back from South America. Given my previous background, I feel bound to take a neutral, objective, evidence-based, science-based, research-based approach to crafting this legislation. I'm calling for a provincial framework. I'm calling for an action plan through our Ministry of Health. A plan that first and foremost encompasses surveillance, education materials, and guidelines. Guidelines for prevention, identification, diagnosis, treatment, and management, including emergency preparedness, and it calls for the sharing of best practices provincially and across our country. It would instruct the Ministry of Health to bring in legislation to bolster research, collaboration among all concerned, and particularly those in the public. And I would ask for referral to a standing committee for hearings, and I also know there's call for a select committee, and there's different ways we could go, of course. It indicates a website should be set up within a year. So again, one of my goals really is to facilitate an efficient, more effective allocation, essentially, of what I consider scarce health resources. Going back to prevention, It's much more cost effective to prevent than to treat. We know the worldwide cost of SARS, for example, was $40 billion. The bill in Canada came in at $2 billion. So prevention is key. Prevention is certainly key when there is no vaccine or no effective treatment. Obviously, when you're dealing with a particular affliction like that, prevention is the only option. As far as definitions in general, the legislation, when we talk about vector-borne or zoonotic diseases or infectious diseases, their transmission involves an animal host. In some cases, it involves a vector. It may be a mosquito with respect to West Nile. It may be a tick with respect to Lyme. And over the past 2 millennia, there certainly have been periods in history where disease outbreaks have wreaked havoc in human populations. Advances in medicine have tamed much of this, but complete eradication is still at bay for so many diseases. And those dealing death, like the present concern with Ebola, get most of the attention, but other newly arrived diseases like West Nile, there's quite a ruckus about West Nile, certainly in my area down on Long Point and Lake Erie 7 years ago, or Lyme disease, devastating for those who have been and may have picked it up. Changing environments, diseases are changing, and those in charge need to change and accommodate, and as do the rest of us. So that my concern is these newly arrived diseases, the unknowns, they're competing with, they compete for attention, they compete for scarce resources, and to partly accommodate that, I call for a framework to set priorities with respect to allocation of resources. I mentioned surveillance. Going back to surveillance, we need a program that must be designed to properly track incident rates, and to track associated economic costs. Timely and accurate information is crucial to detect, to monitor. As I said, it's more effective to prevent rather than to treat. We know that from SARS, and part of that was blamed, as I understand, on lax prevention and hygiene. A few decades ago, so many of these diseases I've mentioned were not a concern in Ontario. That has changed. There has been what I consider a kind of a clear and immediate threat, and again, the importance of education. We just can't get all our information from CNN or from websites. In my area, and I do try and put out the word, if you're involved in farming or fishing or hunting or biking or spending a lot of time outdoors or working outdoors, I think of our M&R staff, for example, you have to keep an eye out for the symptoms. This summer I met with 3 people in my constituent office, and they all reported they felt they had Lyme. They felt, like others in their situation, that the healthcare system wasn't there for them. Often, and in this case, they reported they were paying out of their own pocket. They received diagnosis in the United States, and I just think that's unfortunate. So the stories are different. I mean, these 3, they're in the prime of their lives. They saw a debilitating change when they caught the diseases and were diagnosed, and they were concerned. They felt some of the MRIs were unnecessary, the other procedures. They advocated the long-term antibiotic treatment. I feel the jury is out on that one. I'm not taking sides on any of those issues, by the way. That's up to government. We have government for a reason. That's up to the framework, the action plan, the process that I'm proposing to make those kinds of decisions and to continue to make those kinds of decisions. Lyme disease, it's the black-legged tick. I don't have time to get into a lot of detail. It's a hot spot down in my area, the North Shore of Lake Erie, the North Shore of Lake Ontario, and along the St. Lawrence. Both Long Point and Turkey Point were very early hot spots. The signs are up there, but I don't see people. We have hundreds of thousands of people come to our provincial parks in the summer, and I don't see them with, long pants and socks rolled up into boots to, protect themselves from ticks. West Nile, that's mosquito-borne, as we know. Mosquitoes, they like long grass and standing water, and most people infected develop no symptoms. About 20% will develop what is known as West Nile fever, and I don't have time to go into the symptoms, but again, as with other zoonotics, in this case, animal host first detected in Africa in the 1930s and detected in Ontario in birds. And I know at the time I had spent one weekend driving around with a dead crow in my trunk waiting for Monday morning to take it into the health unit to be tested. I mentioned West Nile and Lyme. Other vector-borne would include equine encephalitis virus, malaria, yellow fever, travel-related, not endemic transmission within our province of Ontario. We hear so much about Lyme, and including probable cases. Our public health system identifies 185 cases in Ontario. There's more cases of malaria in Ontario, actually, 220, and West Nile comes in at 239. So, Speaker, I feel there's much work to be done, hence my proposal with respect to a comprehensive framework and an action plan to address new and emerging diseases. Thank you.
Thank you. We'll have 2 minutes for a response.
Well, thank you, Speaker, and I certainly thank the presenters and actually a good mix of presenters and a good mix of experience. 2 physicians, 2 cabinet ministers, a number of people that obviously in our role have a lot of hands-on listening to constituents, and I don't have time to go through all of the constituencies represented in the speaking, but with respect to Lyme, there is more work to do. Province of Ontario, we're all very proud of our healthcare system, and we continually strive to improve that system. And with respect to Lyme alone, which many people referred to that, there is controversy. There are disputes. There's so much out on the internet. I'm very pleased that member for Huron-Bruce made mention of the fellow that was in the media studio, Will Yelland, from my Consted office. He weighed 220 pounds when he came down with this. I think he's lost about 100 pounds. He wanted to be a cop. Yeah. And he's on hold right now and has spent 40 grand. I think we're positioned well for Ebola, an emerging infectious zoonotic disease. Our Minister of Health, before he was elected, many know his background in public health, in tropical medicine, his travels in the tropics, can serve us well. All I ask, we continue to improve, to consolidate, to pull together our efforts into the framework, the provincial framework I'm proposing, and most importantly, an action plan to deal with not only the diseases talked about today, but those that may come along in the future. Thank you, Speaker.